infected, or if you would have to self-isolate, would this seriously disrupt your upcoming plans, priorities, and responsibilities? 2, are there people at high risk of developing serious complications of COVID-19 in your household or in-person contact bubble that you could unintentionally infect? Then ask yourself 2 questions about the location of the event. 1, has the host made changes to the location to reduce the risk of spreading COVID-19, including making it easy to maintain a physical distance from others while indoors and requiring others to wear face masks? 2, are you able to adjust your plans at the event or activity, for example, by stepping away if it gets crowded, wearing a mask, and washing your hands? Finally, know there are things you can do before you go to an event or activity that can reduce your risk and the risk to your loved ones. As I've said many times, if you have any symptoms, even mild ones, stay home, stay away from others, and get tested. Keep up with effective public health practices, such as physical distancing, hand washing, and wearing masks or face coverings. And limit the number of locations and events or activities you attend in the days and weeks before a planned important activity to reduce the risk of spread during the event. This will provide layers of protection to keep you and those you care about safer. It is important to remember that just because you know the people at an event outside your household and contact bubble, it does not mean the risk is in any way reduced. Don't let your guard down. Keep following good public health practices. Donc, gardez le cap and bonne fin de semaine. Have a safe long weekend, and let's head into the fall with confidence that we'll get through this together. Thank you. Merci.
Thank you, Doctor. We will now open the floor and the telephone line to question. Vous pouvez poser vos questions dans l'une des 2 langues officielles. We ask that you limit yourself to 1 question and only 1 follow-up. For those asking question in the room, we ask that you make your way to the freestanding mics. Today we'll start in the room. CBC?
Perry with the CBC. Dr. Tam, can I ask you, you've had about 2.2 million people download the COVID Alert app. I think it's 125 people who have reported symptoms. How would you rate the uptake so far on the COVID Alert app?
So the more the better, that's all I keep saying. And so 2.2 million or so, I haven't looked at the latest figures, that's the last that I heard, in the context of Ontario, is actually not too bad. I mean, I looked at some of the other countries, I mean, even from a single country, the download hasn't been this high. But we can definitely do better. And I've been encouraging more people to download, particularly those who have phones and who perhaps in the younger age groups who frequent places where you can't account for all of the contacts is really, another way that you can help with faster notification and contact tracing. I was really happy to hear from Ottawa, for example, that the first case that's been reported after someone loaded their key after they got the positive lab test, and someone actually then got tested themselves. It was found to be positive. So that's we need to certainly hear more about that. But there is no doubt that we should do better. And I think for people who have downloaded the app, just remember if you get a lab test to actually download that key, because this Ottawa example has shown that it can work. And I certainly look forward to other jurisdictions then joining in the near future as well. And so I do think that we should give it some time and then have a look further to see how it's working and go on from there. But, Labor Day, long weekend, people going back perhaps to educational institutes, those kind of settings, you can't necessarily account for every one of your contacts, then I think it's good to download that.
Thank you, Doctor. Follow-up?
How are you measuring, I guess, the relative success of the app? Is it just the downloads, or does it go beyond that?
Well, I think that there's many ways to measure it. I think the downloads is one. And as I said, the number of people who actually key in their, special key once they get a positive test is one. Ultimately, of course, getting people who have been notified and get tested is another one. But we would have to work closely with local and provincial public health because that kind of data is much more readily available, of course, at that level.
Thank you. Prochaine question à Radio-Canada.
Oui, bonjour, Philippe Vincent Foisy de Radio-Canada.
Next question, Radio-Canada. Hello, Dr. Tam. This week, you surprised many people with your recommendations regarding sexual relations. You said that people should carry a mask and that even single sexual relations would be a good thing. Is there a big risk of transmission with non-regular partners, or are you going a bit far with this recommendation? Answer: I encourage people to read the recommendations, to read them carefully. These recommendations are for people who may enter a sexual relation with a new partner. That is, with someone who is not in their social bubble. They are not in your close social bubble. They're not people that...
I know, I know very well that young adults, for example, who are returning to university or doing something similar, are being careful with relationships with people who are not in their social circle. There are many ways to reduce the risk. Masks are one of these ways. Symptoms, right? Do not get close to someone if you're sick. N'approche pas les gens quand tu es malade. C'est la première chose.
Don't go close to people if you're sick.
Sometimes your alcohol and substance intake, that changes your judgment. That's another layer. We know, guess how this virus is transmitted? Through your respiratory secretions. We're talking about saliva testing. The saliva has virus. If you don't know the person, if you do not know enough about this relationship, take care. If you're going to enter the relationship, this is a harm reduction measure, consider wearing a mask because fundamentally saliva is how you're going to swap viruses. And also be aware, what I've just said is take your own risk assessment. If you have underlying medical conditions, reevaluate your risk. Do you know what your partner's underlying medical conditions are? And that's on top of safer sex practices like using condoms. STI rates, and we talk about other things happening at the same time as COVID-19, are increasing. So layer on your safe sexual practice. So I wasn't really talking about people that you've already entered into a trusted relationship where you can take all those measures. It's just that I know that some people, as social spaces open, as people increase their mixing, is going to have to take some educated approaches to reduce the risk. Donc, c'est tout.
That's all.
Pour faire un peu de millage là-dessus, mais plus largement,
follow-up question. We heard Premier Legault say that the standards have been relaxed. He's worried by the rise in numbers. When you look at what's happening in the country, with fall coming, universities open, students going back to school, there's an increase in risk factors. How do you feel? How do you see the situation? Are you worried?
Donc,
Answer. Well, our country is vast, and the situation varies from one province to the other, from one territory to the next. There are neighborhoods and communities and provinces with very few cases. However, In large cities and in some regions of the country, there has been an increase of cases, especially among young adults, those between the age of 20 and 39, for the most part. So it is very important to reduce the risk fast and now. Another important number, the hospitalization rate. Of course, the death rate is important too, but the hospitalization rate is one key. Right now, it's very low. There has not been an increase in this rate of hospitalization. However, it is truly necessary to stay the course.
So right now, the rise in cases is in young adults, and there is something that we can do about this. So again, you can actually reduce this by everybody following public health measures, which is what all of my colleagues around the country are trying to do. They will have no hesitation to increase public health measures should they see that things are not going in the right direction. But none of us wants to go backwards. So the only way to not sort of go back and have more restrictive public health measures is if everybody actually does their part. A lot of the clusters or outbreaks are in private settings, within families, parties. But if they see there's more cases in pubs, karaoke, and those situations that cannot be managed by increased sort of review of the existing measures, I'm sure they'll do whatever they need to reduce the cases. So, but as I've said, the fall, as people come back to congregate more indoors, we are going to expect some resurgence. Now is the time to get serious, really. But everybody can do their part. Young adults, as I said, have lots of ways to be able to use their ingenuity, use their knowledge to reduce the risk amongst themselves and others. But remember, you have parents at home, you have grandparents, so do your part also in helping us reduce decelerate the acceleration that we're seeing in some parts of the country.
Comment inaudible for interpreter.
Every day I'm watching things very closely with provinces and territories. Right now, based on what I've heard from all my colleagues, things are under manageable control. But it doesn't take much if people don't all follow advice. This virus has a way to accelerate. But that's what I'm hearing from public health systems across the country right now. Yes, so I think there were some reports about a statement that I put out just recently. I think sexual health is a really important part of our overall health. And I was trying to provide a reminder, this is nothing new, that if you choose to engage in-person sexual encounter with someone who is outside of your household or your close contact bubble, there are steps that you can take to reduce your risk. And it has to be based on good communication and trusted relationship. But there are layers of measures to reduce your risk. So, as I said, you have to monitor your symptoms. Do not get close to someone if you're sick. Stay home. Limit the use of alcohol and other substances if it's going to reduce your ability to take control of your situation and know that you're taking the measures. Saliva, respiratory secretions are where viruses live, the COVID-19. So reducing face-to-face contact, kissing, putting on your mask is layers of protection. That's actually quite sensible. And be aware if you or your partner is at high risk of medical conditions. So, as well as, of course, other safe sex practices, using a condom, etc. So it's really also targeted at young people who are already having an increase in risk. So if you're looking at a population, this is the group that has an increase in rates. And if they're going back to university, if they're increasing the socialization, much as we ask people to distance themselves, they're going to get into these situations, and they can take strength from themselves, take control and reduce the risk. So it was just a set of what I think aligns with other guidance and practices that many public health institutions have already provided.
Thank you, Doctor. Next question, CTV.
Hi, Dr. Tam. Kevin Gallagher, CTV National News. We've seen before, after long weekends, particularly, say, Canada Day long weekend, that there are increases in infections, sometimes regional outbreaks. So what have public health officials learned now going through the summer, and how does that tie into your advice on sort of how to be safe during this Labor Day long weekend?
Yes, so again, I think the situation appeared to have been a bit different across different parts of Canada, but we did see during July some increase in cases, which of course have been put under manageable control. It takes a lot of work from public health to and on the work of the part of the public to keep things at manageable control. So anything that anyone can do individually to reduce the risk to themselves to transmission is really important for Labor Day, especially as we are getting kids back to school and also post-secondary institutions looking at how to reduce the risk in their own setting. So you cannot hold big parties, gatherings, privately or otherwise. It is the kind of setting, we've heard it from British Columbia, from other provinces, that it's those kind of settings that have contributed to outbreaks, some of them pretty large. So you have to respect the physical distancing measures beyond your immediate social circle and keep that social network consistent. That's the other aspect of that as we go into the fall. So there's lots of things which could escalate cases in the next several days. The sort of the vacation behaviors, get that managed. It is getting cooler. I can sense the weather changing and people sort of being less outside. Prepare your indoor spaces to make them safer. And try and today I offer some questions that people can ask themselves before they engage in any activity or event. We'll take a look at them and all the public health advice. All I can say, it has worked. Public health measures have worked to date in reducing cases. So we can do it, but it takes work to keep it under that slow burn. But we have to keep it there because it actually enables us to keep the social economic spaces open in this sort of new normal context. So you're absolutely right. So any long weekend, we have to keep reminding the public and everyone keep reminding themselves that whatever you do, every single person's behavior counts.
You mentioned schools reopening, and that's a major concern for a lot of people, that there will be an increase in cases as more kids go back to school and then coming home to their parents, seeing friends they haven't seen in a long time. What metrics are you and other public health officials watching? What are the main concerns? Obviously, like what can be done to alleviate concerns about children going back to school, but also what needs to be paid attention to know if the situation is getting very serious or perhaps posing a greater risk than is worth having. So certainly is a topic that's at the top of family discussions and all across Canada. And schools, local public health, teachers, parents have been sort of getting together to plan for making schools as safe as possible. The first thing is, as we keep reminding everyone, that schools, the first thing is to ensure that you keep community transmission low. Based on what we've seen in other countries,
You will see cases in schools, but they reflect what's happening in the community. We need to gather more information from any school-related cases. And so working with chief medical officers, we have to work together to have cases that are in schools reported and any outbreaks. Of course, you can get cases from schools reflecting your community acquisition, but you need to investigate if there's more than one case whether any transmission could have occurred in that school setting. So far, internationally, there have been some reports, but there's many, many thousands of schools that have opened safely. So I think we are working together on how to report outbreaks consistently, how to investigate them in a more harmonized way, so we can learn more about what actually happens in schools. We can also learn more about not just where there have been cases, but where there haven't been cases. So what measures have worked? And so those are the kind of areas of information sharing and gathering, I think, that we need as we go along. The other thing is just to keep reviewing the data and course adjust as needed. So at an individual school level, but also more broadly, the provinces will look at their policies as well. So this concept of mitigation, management, learning from that cycle and adjusting based on those lessons learned. The other thing, obviously, at a more macroscopic level, you can also look at shifts in the age group of COVID-19 cases. So we know it shifted from a certain demographic for the first wave, which is a lot of more seniors affected, into this young adult age group. We're watching the young adult age group really carefully to see if it spills over back into the older age group. The next thing we want to look carefully for then is the under 19s. Within the under 19 age group, we want to be able to break down into the younger kids versus the youth and adolescents so that we can learn about. So those are some of the indicators for sure that we'll be looking at. And then from them to see if they are capable of spreading. So right now, what we know is that perhaps older kids are more like young adults, whereas younger kids appear not to be spreading in other, based on information to date. But again, we don't have all the information, so it is important that we keep collecting the information.
Thank you, Doctor. We will now turn over to the phone. Opérateur, prochaine question.
Operator, next question. Our next question from Le Devoir. Please go ahead. Hello, Dr. Tam. I'd like to hear you talk about school children transport. Do you think that we need to reduce the number of children in each school bus to allow greater physical distancing? Answer. We've set up guidelines for school transport.
Institutions éducatives and même les transports pour les élèves. Donc,
for school transport and for educational institutions in general. There are methods for reducing risks. For example, physical distancing, of course.
On peut mettre les enfants dans la même famille.
Children from the same family can travel together. And there can be a reduction in the number of children in one single bus. Of course, children can also wear masks in the bus if ever physical distancing is not possible. This provides another layer of protection that reduces risk. Follow-up question. I'm asking because the masks are compulsory in school buses, but in some regions, only a certain number of children will be able to travel in the bus. Is it really necessary in addition to wearing masks to reduce the number of children in a school bus, there are also school children who travel by public transit. And in that case, there is no control over the number of travelers. Answer. There are several ways to reduce risk. I don't know all the situations. Perhaps in some cases it's possible to reduce the number of school children in a bus. In other cases, no. The school policies
to stagger the start time for a certain group, the
schools will stagger start times for certain groups of school children. This will reduce the impact in school transportation. There are also rules concerning mask wearing. For example, for staff, people staffing the school buses and in other areas. Thank you, Doctor. Next question. There are no more questions for the time being. Thank you very much. The press conference is over for today.
We were listening live there together on CBC News Network to Theresa Tam, Canada's Chief Public Health Officer, and really telling us not too much that we haven't heard before, but suggesting that there are some worrying increases in numbers among young people, 20 to 39 age group. And as this long weekend comes in, and perhaps you have, Labor Day Monday off, there are people who will be, deciding to get together, etc. There will be alcohol perhaps involved. And she says that people in those groups where the numbers are increasing in some cities must take extra precautions and be aware of the fact that whether they're entering into a new relationship, that COVID-19 is passed through respiratory exhales and through saliva. So she was talking about kissing there. Right now, however, and perhaps this is a glimmer of hope, she says things are under manageable control. That's the message she's getting from the provinces across the country. But, and this is where the warning comes in, she does say it doesn't take much to change that. So we'll be listening for any reaction from the provinces. We will be getting, COVID-19 updates from across the country for you, and we'll keep you informed right here on CBC News Network. Speaking of updates, I want to take you now to Sorel, Quebec. While Theresa Tam was speaking in Ottawa, Quebec Premier François Legault was talking about the status of COVID-19 in his province, and he did take a couple of questions in English. So let's listen together here on CBC News Network.
Yes, Mr. Bachan.
So, Mr. Legault, there are 184 new COVID cases today. We are above the 20 per million new cases. It's a long weekend. There will be family gatherings. So, what are you telling Quebecers today to do over that long weekend?
Okay. Of course, we have a long weekend, so there'll be a lot of gatherings. I think what I'm asking all Quebecers is to be careful, to keep 2 meters, wear a mask. I think it's important. We see that there's not a specific problem in bars or in some places. It's really everywhere. People have to be careful. I understand